I think everyone should consider trials, especially if they've relapsed from the standard therapy, because trials, the data shows that people who enter trials survive longer than those who don't. So in America and Britain particularly, people are very lucky that they have the opportunity to enter trials far more than we do in smaller countries such as Australia. I chose this trial, and I was already looking at this trial in Australia and wondering if it would open, because I strongly believe that for people who are fit and healthy enough and young enough like me, chemo is fantastic. It's 6 months and then you get your life back. And it's worth going in as deep and hard as possible to be able to get that length of remission, that deep remission. And I was looking for novel therapy that would give me a deep remission without having to continue taking a tablet every day for the rest of my life, being reminded that I have cancer and it's not going. And ibrutinib is a wonderful drug, and especially for older people, it is changing their lives. They're getting their quality of life back. But for people of my age, it's not getting you into a complete remission. It's not getting you into no detectable disease. And eventually, the early data is showing that the disease is breaking through the ibrutinib. And with clonal evolution over many years, I've already had the disease 4 years, and luckily I haven't had any additional deletions to the original 6q. But I will get them if I still have disease that is lying dormant, so to speak. So this trial is like a chemotherapy in my head. It's 6 months. We hit it really hard with a fantastic monoclonal antibody and immunotherapy, and then I'm going really deep with ABT-199, and hopefully at some point I'll be able to stop taking the drug, and then we'll monitor me, and if it comes back, as the diseases want to do, I don't think we'll ever be able to say you're cured, or maybe if I get 10-year remission we can say I'm cured, but I'm not expecting this to cure me, but I am expecting it to give me a deep remission. And if it doesn't give me a deep remission, I will be very happy to take the risk of a stem cell transplant, because I know I've thrown the kitchen sink at it and the disease is still coming back. So I think the fact that it's a limited time was worth travelling around the world for.